Part 2 of renal. We'll start with UTIs, or urinary tract infections. The cause is usually a gram-negative bacilli, such as E. coli, Pseudomonas, Escherichia coli, Pseudomonas, or Proteus as the usual culprits. When somebody has a UTI, they're oftentimes asymptomatic, no symptoms at all. Or they may have frequency, burning, low back pain, hematuria, painful urination, which is dysuria, and cloudy urine. There are different types. We have cystitis, acute pyelonephritis, and chronic pyelonephritis. And we'll talk about those in just a second. Risk factors, it occurs more in women because we have a shorter urethra and it is angled differently. That's why women should lean forward to urinate to make sure that they empty their bladder, where men stand up, and you lean back to defecate. And we usually defecate once or twice a day, but all the new commodes have you leaning back all the time when you urinate. So ladies, lean forward. It will help to empty your bladder and prevent urinary tract infections. Risk factors are premature newborns, sexually active or pregnant females, females on antibiotics, spermicidal users. If you're postmenopausal and not using estrogen, because estrogen maintains the pH down there and helps to prevent bacteria from crawling up your urethra. If somebody has a Foley, Foley catheter, if they're diabetic, if they have a neurogenic bladder, or urinary tract obstruction. All those are risk factors for UTIs. And here from the memory book is showing somebody with a UTI. And as I said, it's usually female. So the different types. Here's cystitis. Cystitis is inflammation of the bladder. It's the most common form of a UTI. Those at risk are females, ages 20 to 30. And as I said, women have a shorter urethra. Diabetic. So why diabetics? Hopefully you said the high blood sugars and the glucose that is secreted in the urine when you reach the diabetic threshold of 200, thereabouts, cause bacteria to grow. Urinary obstruction. Anytime urine sticks around longer, it's likely to grow bacteria. Why pregnancy? Oh, we don't empty the bladder. It stays nice, warm, and full, and a good growth medium. Sexually active. Do you always know where your partner was sticking things? Is he then going to stick into you? Or you're going to get it from something you stuck into? Be very careful. And men over the age of 50, and this is because of BPH. Symptoms, again, asymptomatic, or they may have frequency, urgency, painful urination, burning, low back pain, hematuria. Symptoms we talked about of a UTI. Causes bacteria, but it can occur without an infection. And if it is bacteria, it's the Escherichia coli, Pseudomonas, Proteus, Klebsiella. It might even be Staphylococcus, but that doesn't happen quite as often. Now, children, is due to Escherichia coli ascending the urethra. In infants, they're going to be asymptomatic, or they're going to have a fever, be lethargic. They may have some vomiting, diarrhea, or jaundice. In children, it tends to be between the ages of 7 and 11. They'll have a fever, frequency, urgency, painful urination, bedwetting, incontinence, hematuria, and abdominal pain. Your urinalysis will be positive for nitrites and leukocyte esterase, which is a breakdown product of white blood cells. painful bladder syndrome or interstitial cystitis. There are 3 types of it. Non-bacterial infectious cystitis, non-infectious cystitis, and interstitial cystitis. Symptoms are frequency, urgency, painful urination, and nocturia, going during the middle of the night. But they will have negative urine cultures. This tends to occur between females between 20 and 30. Interstitial cystitis is the persistent chronic form of non-bacterial cystitis. It's possibly autoimmune in nature, and your symptoms, they will have a hemorrhagic ulcers of the bladder, which you'll see on your cystogram, bladder fullness. They'll have small urine volume with frequency, nocturia, and chronic pelvic pain. Acute pyelonephritis is infection of the renal pelvis, pardon me, and the interstitium of one or both kidneys. Those at risk are people who have kidney stones, who are pregnant, have a neurogenic bladder, and women, particularly after sexual trauma. Kidney stones and pregnancy occur because of obstruction. The neurogenic bladder occurs because of the vesicoureteral reflex, and the fact that it's women, we've got that short urethra. And there's a table you need to look at on page 749 that talks about the different risk factors. Symptoms are fever, chills, flank and groin pain, frequency, dysuria, hematuria, and white blood cell CAS. Cause are E. coli, Proteus, Pseudomonas, ascending along the ureters and on into the bloodstream. In children, the symptoms are chills, fever, flank and abdominal pain, and enlarged kidneys. There's a picture on page 749 you might want to look at. Chronic pyelonephritis is persistent or recurrent autoimmune infection of the kidney, causing inflammation and scarring of the kidney. Symptoms are hypertension because of the release of renin, the angiotensin, aldosterone, so we're increasing volume. Frequency, dysuria, flank pain. Children tend to be asymptomatic. It will result in progressive inflammation of the interstitial spaces between the tubules. It can cause atrophy or dilatation of the renal pelvis. It can lead to chronic renal failure. Chronic obstruction will cause destruction of the tubules, alter the renal pelvis, and cause scarring. The end result is that they will have the impaired ability to concentrate urine. So their urine output will increase. You can also have, another cause might be progressive inflammation of the interstitial spaces between those tubules that will cause chronic interstitial nephritis. And this can also occur because of drugs such as aspirin, acetaminophen. Can also occur because of ischemia, radiation, or immune complex diseases. Vesicoureteral reflux is the retrograde flow of urine from the bladder into the ureters. It prevents the complete emptying of the bladder and causes infection. Primary cause is congenital abnormality or insertion of the ureter into the bladder. Secondary cause is more serious, and there's a figure on page 769 you need to look at. Recurrent UTIs and unexplained fever, poor growth and development, irritability, and feeding problems occur in children. Occurs with a family history of UTIs, reflux, dysuria, and nephropathy. Again, it occurs more often in females because we have that shorter urethra. Glomerular disease is the most common cause of chronic and end-stage renal failure. And there's a table on page, I think it's 751. You'll have glomerular damage that results in a decrease in surface area, increased interstitial edema, decreased hydrostatic pressure, and an increased serum creatinine level, and a decreased creatinine clearance. You'll have a decrease in your glomerular filtration rate. So you'll have edema, an elevated BUN, blood urea nitrogen, hypertension, proteinuria, and hematuria. So why do you have hypertension? Because you have an increase in fluid volume, and that increase in fluid volume is also causing the edema. And you have the increase in fluid volume because you're saving more sodium and water. Proteinuria occurs because of an increase in capillary permeability. And hematuria occurs because of an increase in your glomerular permeability, allowing red blood cells through. Most glomerular disorders are due to the immune dysregulation from type 2 or type 3 hypersensitivity reactions. And from the memory book, here's a type of glomerulonephritis. In kids, it oftentimes occurs after a strep infection. So here is post-streptococcal glomerulonephritis. This is a type 3 hypersensitivity reaction. You get inflammation that causes thickened membrane and a decrease in your glomerular filtration rate. Your risk factors are associated with group A beta hemolytic streptococcus. They usually occur 7 to 10 days after an upper respiratory infection or a skin infection, and it tends to occur more so in children. Symptoms tend to occur 10 to 21 days after the infection. You'll have red blood cell casts, and that red blood cell cast will cause hematuria. You'll have damage to the basement membrane that will allow the large protein molecules to escape into the urine, so you'll have proteinuria. You'll have decreased filtration, so that will cause oliguria. You'll have increased hydrostatic pressure in the vascular system because you're not dumping the urine, you're saving the fluid, and so you'll have edema, ascites, and hypertension. Nephritic sediment means that you have blood, casts, and maybe protein. Nephrotic sediment means that you have protein, lipids, and maybe blood. In children, they're oftentimes asymptomatic, or they may have the abrupt onset of flank or mid-abdominal pain. They'll be irritable, they'll have malaise, fever, hypertension. Hypertension can cause headaches, vomiting, somnolence or sleepiness, and seizures. They'll have circulatory overload that causes dyspnea, difficulty breathing, tachypnea, rapid breathing, and enlarged tender liver because of the increase in volume. It tends to occur more so in cold weather, particularly after an upper respiratory infection or after impetigo in your warm, hot weather. It lasts about a month with 95% of the patients totally recovering. Rapidly progressive glomerulonephritis can be idiopathic, in other words, we haven't the faintest idea what causes it, or associated with proliferative glomerular disease. It develops over days to weeks, usually occurs in adults between the ages of 50 and 60, and the symptoms are renal insufficiency progressing to renal failure, hematuria, proteinuria, edema, and hypertension. Now, a type of rapidly progressive glomerulonephritis is Goodpasture syndrome. And with Goodpasture syndrome, you form the antibodies against pulmonary capillary and the glomerular basement membranes. Those at risk are males between 20 and 30. Symptoms are hematuria, edema, renal insufficiency, proteinuria, and hypertension. Prognosis is poor because it rapidly progresses to acute renal failure and acute respiratory failure. I took care of a young man who was 26. He had 3 children under the age of 10. His wife had never worked outside the home. He was a construction worker. He got a staph infection and came into the hospital in respiratory failure. Pardon me. And he was on the vent. We got him better. We're talking about sending him home, and he went into renal failure. And that's the first time we really realized that he had Goodpasture syndrome. Unfortunately, he was not able to leave the hospital. He was there for about 6 weeks, and then he died. Chronic glomerulonephritis is due to deposits of antigen-antibody complexes in the glomerular capillary wall or formation of antibodies against the basement membrane. Those at risk are your type 1 diabetics, patients who have systemic lupus erythematosus, or chronic hypercholesterolemia, high cholesterol levels. This will lead to renal insufficiency, nephrotic syndrome, then renal failure after about 10 to 20 years. The severity depends upon the size, the number, location, and duration of exposure, and the type of the complexes that are formed. Now, the hematuria will occur because of the red blood cell casts, and that will turn the urine brown to red-colored. They'll have proteinuria, and that they'll lose between more than 3.5 grams of protein per deciliter of albumin in a daily area. They'll have the hematuria, as I said. They'll have a decrease in their glomerular filtration rate, so you'll retain fluid, so you'll have hypertension and edema. There's a figure on page 750 and a table on page 753 that talks about the different causes of this. Nephrotic syndrome is excretion of 3.5 grams or more of protein in the urine daily. Children tend to develop primary nephrotic syndrome and may lose as much as 10 grams of protein a day. If it's secondary, it's due to diabetes, amyloidosis, systemic lupus erythematosus, medications, or infections. Your secondary symptoms are in a table on page 754. You need to look at that, but it's proteinuria, edema, hyperlipidemia, lipiduria, so the urine almost looks frothy white, vitamin D deficiency, hypoalbuminemia, so your albumin levels are really, really low. That's why you have lots of fluid in the tissues causing the edema. And you'll have increased susceptibility to the infections because you don't have enough immunoglobulins. That causes a major problem there. Primary nephrotic syndrome, they don't really know the cause. It's maybe due to an increase in glomerular basement membrane negative charge and an increase in glomerular capillary permeability. Tends to occur more in preschool children between 2 and 3. It's rare after age 8. Tends to be boys more than girls.